Hello everyone, welcome to the Weekly Delights episode number 4. We are going to discuss a very important conceptual topic from ophthalmology over here, that is PARC 3-step test. Now what is this? Before going to that, we have to quickly go through the very important thing, that is basic concepts. Now what basic concepts we really need to know is about the intraocular muscles and their movements. Now two important points I just want to highlight. Nothing else you need to basically know. These two important points are going to be the thing which will build a very basic block when we are going to learn PARC 3-step test. So the first important point I want to highlight is that function of elevation or depression in abducted eye. So if it is an abducted eye, that means a eyeball rotated outwards, then in that case the function is going to be of recti. So if I ask you that what would be the muscle who will cause elevation in an abducted eye, please remember that will be superior rectus, whereas for depression it will be inferior rectus. Understood? So if I am taking an abducted eye, it is going to be an elevation or depression that will be a function of recti. The second thing I want you to fit in your brains is about the intorters and extorters. Always remember that the superiors are intorters. That means if this is the eyeball, then along the longitudinal axis of the eyeball, the rotation of the eyeball inside will be, that is medially, that is towards the nasal side, will be a function of superior muscles, that is superior oblique, superior rectus. You can remember it as a mnemonic, that is SIN, superiors intort. So if I ask you who would be an intorter of left eye, then it would be left superior rectus, left superior oblique. Who will be the extorter of left eye? That will be the left inferior oblique and left inferior rectus. These two concepts and everything is sorted out. Now what is PARC 3-step test? So PARC 3-step test is basically used to identify the muscle of involvement in hypertropias. Now what are hypertropias? I hope everyone knows. If I consider two eyes, one eye and the second eye, the right and the left, in that case, if I see that my eyeball on the left side is deviating upwards or is misplaced upwards in the primary gaze position, then it will be called as hypertropia. Now remember, in such a cases there is possibility that this could be a hypotropia of other eye also, but practically we always consider hypertropia as the chief abnormality because it helps us to identify accurately using PARC 3-step test. Understood? So this is going to be the main thing that we are going to basically use for diagnosing the muscle involved in cases of hypertropia. Now how you are going to do that? That is what is the PARC 3-step test. Let's take a very simple example. Okay, let me give you a very simple example. My patient is having left hypertropia. Okay, suppose we have a patient of left hypertropia given to us that increases with left horizontal gaze, and it increases with left head tilt. Okay, such sort of questions will be given to you. We'll take a one clinical scenario at the end of this video also to look at how do you actually solve MCQs and what type of questions do you get from this concept. So basically this is an example that I have given where everything is left, left and left. So what is the concept here? So the thing is that my patient is having left hypertropia, right? Imagine this is a patient who is having left hypertropia. So the first step that I need to know is to identify possible muscles. Okay, to identify possible muscles. Now, as I told you in the introduction itself, there is one possibility that this could be an abnormality of elevators of right eye, or it could be an abnormality or palsy, basically a palsy of elevators of right eye or a palsy of depressors of left eye, right? Any of these two is the possibility. So the thing I need to basically look at is what could be the possible muscles. Now this being a primary gaze, tell me what could be the abnormalities related to the left eye, that is which muscles. So I told you that the muscle which is causing depression is paralyzed on the left side. That's why in the primary gaze the muscles which are elevating will superimpose their action, and that's why the left sided eyeball is moving upwards, right? So now here what would happen if it is a right eye and left eye? That is just a thing that I need to take care of. So now if I make a very simple diagram for you people, suppose this being the nose being represented, this is cross viewing diagrammatic representation. I told you medially, that is on a nasal aspect, who will be the main elevators and depressors? Obliques. So this muscle will become right inferior oblique, left inferior oblique, and this will become right superior oblique, left superior oblique, right? Because obliques, the name itself suggests they function exactly opposite to their names. Okay, whereas this will become left superior rectus, left inferior rectus, and this will become a right superior rectus, right inferior rectus, right? Now since in my patient I am having a elevation of the left eye, that means I would suspect that depressors might be abnormal in the left eye. So who are the depressors in the left eye? The depressors in the left eye are left superior oblique, left inferior rectus, right? Whereas for my right eye, those will be the elevators which could be abnormal. So right superior rectus, right inferior oblique. These are the four possible involved paralytic muscles for my case that I have taken hypothetically. So in the first step, what possible muscles I have? Right superior rectus, right inferior oblique, left superior oblique, left inferior rectus. So these four differentials I have already got from my step 1. Now let's go to step 2. The step 2 is you are going to talk about the horizontal gaze that increases the hypertropia. Now in my patient, if this is the eye, this is the hypertropia, I have said that the hypertropia increases with the left horizontal gaze. So in that case my left eye is abducting, whereas my right eye is adducting. So definitely which muscles could be abnormal for left eye? Definitely the recti, because I told you the basic concepts that elevation and depression in an abducted eye is a function of recti. So the right sided muscle and the left sided muscle, if I want to tell you, then the possibility that I have, if I draw a cross diagram again similarly, then what would happen? try to put it on a paper, it will become very, very simple for you. Okay. Okay. Now in the first step, Now in the first step that I have taken, what muscles we were suspecting of? These two or these two, right? Now in this second step, what I am going to suspect is that possibility is that the elevators and depressors in an abducted eye, that is my left eye, could be abnormal. So the muscles become these two, left superior rectus, left inferior rectus. Whereas for my right eye, which is a adducted eye, the obliques will be the one which will be involved. So the possibility is these two. So these are now the possibilities that we have got up, right? These are the possibilities that we have got up. So now from this given question, this given step, which are the two common muscles I should think of? You can see the common muscles be these two. The common muscles are right inferior oblique and left inferior rectus, right? So the possible pathologies are in these two. The palsies are possible in these two muscles, right? Let's go to the third step. The third step is the head tilt, which is causing the abnormality. That is increasing the hypertropia. Now what is the phenomena? Imagine this to be the head of the patient. This is one eyeball, this is another eyeball. If my patient is tilting the head to the opposite side, definitely to adjust the gaze, to adjust the central gaze, the eyeballs will rotate to the opposite side. So if my patient is tilting the head to the left side, my eyeballs will move in the opposite direction, right? So in this case also, if my patient is tilting the head to the left side, that means my left eye is intorting and my right eye is extorting, right? So just quickly let's write down the step 2 muscles that we had. Okay, I'll show you an example and make it more simple. Step 2 muscles which we draw into a conclusion were right inferior oblique and left inferior rectus. I am purposefully repeating over here so that we can compare and come to a final conclusion. Now here in our patient, the head tilt which is increasing the hypertropia was left head tilt. So definitely my left eye is intorting and my right eye is extorting. So for my right eye and left eye, if I ask you, if my left eye is intorting, which muscles it could be? Sin, that is superior is intort. So it will be which muscle? Which muscle? Left superior rectus, left superior oblique. Whereas for the right eye, those will be extorters. That will be the right inferior rectus, right inferior oblique. Now comparing all the three steps, now you will be clear that which muscle is common to all the three steps, right inferior oblique. So my diagnosis becomes a possible palsy of right inferior oblique muscle. This is what is a Park 3-step test. Now quickly look at a clinical scenario and try to analyze and see how fast we can do that. Okay, now a 13-year-old presented with persistent right head tilt and gaze finding. Now see, gaze finding hai, but the patient is coming with persistent right head tilt. What does this mean? This means that whatever abnormality is, that abnormality increases with left head tilt. That's why the comfortable head tilt becomes right head tilt, and that's why the patient is presenting with right head tilt, right? So the possibility is that a left head tilt is causing some pathology, right? Now abnormality shown worsens as the body tilts his head, the boy tilts his head to the left. That is what we want, right? Which of these muscles is the likely cause of the presentation? Now let's go to the image. Now whenever such an image of different primary secondary gazes is shown to you, always look at the central image. Always look at the central image, because this is the primary gaze. A central image, a central gaze, or a primary gaze, right? If you look over here in the primary gaze, I can see I am having right hypertropia. My patient's right eye is deviated upwards in primary gaze position, right? Right hypertropia. Perfect. Now let's do stepwise. So let's go to the Park 3 step test and apply step 1. Step 1 says which muscle. So right, so if I take right muscles, left muscles, I told you since I am having right hypertropia, there is a possibility that the inferior deviators, that is depressors of my right eye, are abnormal. So those will become what? Depressors of right eye. What are the depressors of right eye? Right superior rectus and right superior oblique and right inferior rectus, right superior oblique and right inferior rectus. Whereas for my left eye, what could be the thing? The elevators are abnormal, right? The elevators are abnormal. So what could that be? Left inferior oblique, left superior rectus. These are the 4 possible muscles, right? So let's go to step 2 now. Now step 2 is that which horizontal gaze is elevating the hypertropia. So for horizontal gaze, you have to look at these 2 horizontal images. If you look at the horizontal gaze, you will appreciate that the left horizontal gaze is elevating or increasing the hypertropia. Look at this eye and look at this eye. You can see that the right hypertropia is increasing with the left horizontal gaze. That means that the eye is moving like this. So for my right eye, I have to think of the ones which elevate and depress in adducted position, and for the left eye in abducted position. So for my right eye in adducted position, who are the elevators and depressors? Obliques, right? So that will become right inferior oblique, right superior oblique. Whereas for left, those will be recti, left superior rectus, left inferior rectus. Now compare the two, right? Compare the two and tell me which two are common. Is RIO common? No, RIO is not common to step 1 and step 2. RSO is common? Yes, RSO is common. LSR is common? Yes, LSR is common. So two possibilities with step 2 is either a right superior oblique or a left superior rectus. Okay, now let's go to the third step. Now the third step में हमको theory में भी दिया था, and we analyzed also that the hypertropia is, there is an increase in hypertropia with left head tilt, right? With the left head tilt only. So if my patient is doing a left head tilt, my left eye is going to extort, right? Let me draw a diagram for you. It's something like this. This hypertropia is increasing with the left head tilt. That means my left eye is extorting, whereas my right eye is intorting, right? So for right eye and left eye, if I have to choose, my left eye is extorting, so those have to be inferiors, right? So those has to be left inferior oblique, left inferior rectus. Whereas for my right eye, since it is a intorsion, those have to be superiors. So right superior oblique, right inferior, right superior rectus, right? So right superior oblique, right superior rectus on right. Now comparing the step 1, step 2 and the step 3, if you look very carefully, what is the possible muscle? RSO, right? So RSO is the most possible muscle in this case. That's why the answer in this case given to us becomes right superior oblique, right superior oblique, right? That becomes the correct answer. Okay, now there is a homework for you at the end of this video. Let's try to analyze this given question. You can see this is a primary gaze. You can see the horizontal gazes in this question, and also you can see the head tilt gazes also. Try to analyze this images and try to come at a conclusion and tell me what could be the answer, which muscle could be the paralyzed muscle in this case, in the comment box. Thanks a lot for watching this video. If you like this, hit a like button, share this video, subscribe the channel and comment down what next things do you want to know. Thank you.